Ninth Street Ministries Clinic in a rural town in Arkansas will be closing its doors at the end of this month because, as they say, their mission is complete now that so many people are covered under the Affordable Care Act. The director of the clinic, Stacey Bowser, said that, quote, because people are qualifying for insurance through the ACA, our free medical clinic will not be needed anymore. She says we've gone from seeing around 300 people regularly each month to a reported 80 people in February and down to only 3 people in March. The director says that the clinic was in place to serve the needs of those who have no insurance or no way or have no means to acquire and maintain medical care. She goes on to say that, quote, our services won't be needed anymore, and this concludes our mission. Arkansas has implemented Obamacare on their own terms, however, under a system that allows for low-income residents to qualify for subsidies to buy private insurance plans on the state's marketplace. So about 100,000 residents so far have been able to acquire coverage through this particular system, and the program has stayed on track financially. Early numbers indicate that over 9 million people so far in the country who were previously uninsured in America have been able to get new coverage under Obamacare. However, unfortunately, there is a bit of bad news, of course. Red states who refuse to implement Obamacare are currently leaving approximately 5 million low-income uninsured Americans without any access to any health care whatsoever.
Yeah, this is what's funny about this is one of the source articles that we looked at for this talked about how Arkansas is one of the let me pull up the quote here. One of the deeply red states that worked with former Health and Human Services Secretary Kathleen Sebelius to implement Obamacare on its own terms. First off, Arkansas is not a deeply red state. What sets Arkansas apart from Alabama and Mississippi, which geographically and culturally are probably the states closest to us, is this blue streak we have that they don't have. That's why we're the state that produced Bill Clinton. That's why even a lot of our national Republicans are fairly more moderate. Now, we are in the throes of the Tea Party era like any other southern state is, so now is not a good time to look for examples of Arkansas progressivism. But traditionally, although we lean red on the national level, locally and even on the state level, traditionally we're much more blue than we are red. And it's just the tradition of Southern, being the Southern Democrat that's died off a lot of places. It died a lot harder here. And it's still alive and kicking, and I think hopefully making a resurgence in the next few election cycles. Yeah, but this is, man, such an excellent story. Actually, I have, Mena is a place that's kind of important to me. I go there and hunt every year. I know people there. They were in our conference in soccer. I used to play them in high school growing up. So this is an awesome story for me. This is a rural town in Arkansas, close to the same size as the one that I grew up in. And what I love about this story, though, is what it does to the whole conservative narrative that government programs create dependency, and the way to fix that is through, through the free market and through private charities or whatever. And then they create this straw man that the left just wants the government to do everything, and yada yada yada, and we hate the free market, and we hate charitable giving and stuff like that. Well, this was a clinic that ran as a band-aid of charitable giving, and did filled a need there. Of course, a need that was created by the free market being allowed to deny people health insurance, but that's neither here nor there. But what was awesome is the government stepped in and fixed the problem, and the Band-Aid was no longer needed. Mm-hmm. And we went from this place probably being overloaded and just swamped all the time and underfunded to having, 80-something people a couple months ago and 3 people last month. If you want to tell me that Obamacare isn't working, and again, Obamacare was the least good option of the better options. I'm not really a fan of Obamacare. But don't tell me it's made things worse. You can criticize Obamacare for its flaws all day long, and I will do it with you. But don't tell me it's made things worse, because it clearly hasn't. And thank God, this story would be a lot better if we had covered the private option battle in Arkansas. But we didn't. But just know this: there was an issue renewing it this year. Thankfully, our legislature got its head out of its you-know-what and renewed it, and that's why these people have health care now. And that's an example of a Southern progressivism in action, where we said, all right, we have a problem with government-run health care, but we'll at least let you get subsidized poor people's health care so they can go buy it and get it, and keep the market involved, yada, yada, yada. And, hey, it's working fantastically. So, awesome. I'm glad, normally when you say, hey, free health clinic had to close, you immediately think, oh, no, those poor people. But here it's because they were out of people to help. So that's amazing, man. Praise God, and way to go, Obamacare.
Yeah, you brought up a couple of good points. I mean, really, this it kind of makes you think about how bad it was before Obamacare. And one thing I noticed, too, and I want to kind of add to it, is in the Obamacare fight, speaking of the conservative narrative, is that everybody who's been railing against Obamacare, for the most part, these were people that were already insured before Obamacare. So to them, insurance, this lack of coverage, this insurance issue, not a problem. I got mine. Why the fuck are you messing with it? Right? And, well, the answer is, of course, we had to mess with it simply because, according to the article, 21% of this county had no insurance and had to rely on this free clinic. And now they no longer have to. Now, it was great that even before Obamacare, somebody came in and filled this need. And conservatives, of course, would jump in and say, well, the free market did take care of it before Obamacare, and they would be specifically right about this case. But, as with anything, they tend to leave out the many other places where the insured were not lucky enough to have one of these awesome free clinics. And they forget that millions of people had no access to health care. And, of course, they also forget that a lot of people died because of it. And so I think those are some very important points that I wanted to add to this discussion.
Well, I mean, like, speaking of kind of the conservative narrative, if any conservative kind of news outlet picks up this story, and because it is a good news story and overall it's good that it's had to close down because they're not getting any business because of Obamacare, that's good. But for the conservative narrative for this story, I'd imagine would be, look at Obamacare, it's closed down this health clinic, it's costing people their jobs, it's going to affect the economy that way, because essentially the people who worked at that clinic, they no longer have a job working there, and no doubt they're probably working in some other kind of form of healthcare somewhere else in the industry. But that's what the conservatives are going to say. They're going to say, look at all these charitable, or they're not going to call them charitable health clinics, they're going to call them private health clinics. Look at all of these ones closing down, look at all the jobs that Obamacare is costing. That's what they're going to be saying, and yeah, it's a piss weak argument.
Yeah, because if there's any field that you can't find a job in right now, it's healthcare.
Yeah, I mean, but that's the thing. It's such a piss weak argument, and this is the case with a lot of kind of the conservative narrative on a number of stories. They have such awful arguments because that's all they can come up with. They can't come up with any strong arguments because the policies, at least for the large part, the policies and arguments that progressives and in some cases Democrats are putting forward, like Obamacare, they are working, they are popular, they are good for the country and good for the people of the country, and that's why the conservative narrative is so awful. They have to try and find something, and some things that they are finding are just so nothing anyway.
That's a good point. And a lot of the conservative narrative, it just means they've run out of ideas. Obamacare was their idea, and they should be proud. The people who thought this up, secretly, you've got to think that they, politically they have to be against it, but you got to think that, if they did actually care about people and actually, because I'm sure some of them actually do. They can't show it, obviously. Not everybody in the conservative movement, I'd like to think, buys their own bullshit, right? They just have to because it's politically expedient. But I would like to think that some of the people that came up with this would be like, hey, you know what? It does work, and it was a good idea.
Well, I mean, the thing is that if you asked a number of conservatives saying, like, obviously, kind of, you'd say you don't want these people having to rely on kind of a charitable organisation, kind of to basically give handouts to these people who don't have healthcare. Hundreds of people a week turning up to this clinic. What would you do to help solve this problem? Like, you've got to recognize that this is a problem. What would you do to help solve it? And how would that solution be any better than Obamacare? And they'll have nothing. They're completely bankrupt on ideas when it comes to healthcare, because whilst Obamacare isn't perfect and there's a number of flaws with it, as Jordan said, it's not making the situation worse. And in so many anecdotal cases, and in the months to come, there will be kind of greater number of statistical studies showing that it is benefiting millions of people, both economically, on a macro scale, on a micro scale for individual families. It's going to be helping people, and the Republican Party and Conservatives they haven't got a leg to stand on. They have completely lost the healthcare debate. They will have nothing going forward into the 2016 election unless they somehow kind of came up with the kind of the individual. I don't know what they'd have to come up with to kind of to trump.
Well, they can't come up with anything because the exact ideas that they came up with, we're using.
Exactly. They've got nothing, and this story just isn't. Kind of another one in a whole chain of stories showing that, yeah, Obamacare's working. It's not working amazingly, but it's still working in a good sense.
Now, let me jump in here with some inside baseball, and the tooting that you hear is my collective Arkansan horn. Stories like this and the success of the private option that we vaguely mentioned, they may be the launching point for a change of opinion, a shift of opinion in these red states. Arkansas may kind of be the first in a tide of pro-Obamacare sentiment, because for better or worse, when something is good for Arkansans, we get behind it, and you cannot stop us. Now, a lot of times that doesn't turn out great for everybody else. Like see Walmart, but the only way that they can prevent that, then, and there's a chance they might do this, is to as brilliant as the big money against Obamacare is to deflect credit. And you saw where during the town halls when that one lady was like, I want the government to stay out of my Medicare, or what, like it's so easy to get people to blame the government for what the government had nothing to do with, and to give credit for things that are happening to other people whenever the government did it. And so if Arkansas doesn't become the place where Obamacare turns a corner, it'll be because they managed to do that. I'm certainly not trying to consult for the other side here, but if they don't do that, then, and watch out, man, because Arkansas will change the South.